Okay, so there are few disadvantages if we are not able to identify the disease at right time. So the most important disadvantage is we are not able to prevent the recurrence in subsequent pregnancy. That is the biggest disadvantage because, like I already gave the example of complex molecule accumulation disorder. Many of those disorders presented later in life. So they present after 3 years, 4 years, 5 years of age. So by that time, the family has already having a second kid, and there's a very high likelihood, very high possibility of having same disorder in the next baby also. Like in autosomal recessive disorder, there is a possibility of 25% recurrence in next pregnancy. So that's the major component because in any country, if the affected population with inherited metabolic disorder is rising, it's a huge economic burden for that country, that state, and for family. So the most important point is prevention of recurrences in subsequent pregnancy. So we need to have a very high index of suspicion and we should identify these disorders. And second is definitely on the quality of life of the patient because as the disease progresses, the systemic involvement, multi-systemic involvement becomes more, and they can have a poor quality of life and they can have a shortened lifespan. So identifying these disorders early can have a we can prevent the disability and death in families, and definitely we can limit the symptoms. First is the correct identification of a correct diagnosis or correct identification of the underlying genetic defect. So that is first and foremost point. If a baby is suffering from a genetic disorder, that patient should be identified with what gene defect is he or she is carrying. Second is fetal medicine consultation. So fetal medicine colleagues are very important because they can do amniocentesis or chorionic villus sampling and they can send the sample for a prenatal diagnosis. We can identify the disorders in subsequent pregnancies by prenatal genetic testing. And if family is willing, they can terminate the pregnancy, or if the baby is normal, they can continue the pregnancy. So that is a very important way. But for that, the first patient, the index child, should be correctly identified. So what disorders he is carrying.